Times have changed, bringing with it numerous changes in almost every aspect of life. Lifestyle has changed. Due to advanced information technology, communications, digitalization, today time is critical for virtually everything. Time is the essence. Today, fast world has also created various unwanted conditions like stress, work issues, anxiety, giving couples very little time for themselves. The result: increasing cases of erectile dysfunction. The result: less time for building relationships. The result: unhappiness. Zydus Forteza, a division of Zydus Healthcare Limited, launching for the first time in India the fastest acting phosphodiesterase type 5 inhibitor, presenting avanext, Evanafil 100 mg and Evanafil 200 mg. Happiness is mutual. Why wait? It's fast. Onset of action in just 15 minutes. Best among all available PDE5 inhibitor. It's effective. Improvement in SEP2, SEP3 and IIEF scores. It's safe. High tolerability and safety profile for diabetes or cardiovascular patients. It has no intake restrictions. Eat and drink what you like. Can be taken anytime. It has least adverse effect. Less incidences of headache, blurred vision and nausea. Let them experience happiness that is mutual. Let's make every patient of ED happy. For the first time in India, presenting the fastest acting PDE5 inhibitor, avanext, Evanafil 100 mg, Evanafil 200 mg. Happiness is mutual. Why wait?
So very good evening to the respected speakers and our viewers. Myself, Dr. Sachin Chaudhary from Medical Affairs Team Zydus would like to welcome you all for today's event on sexual health. Today, we brings to you yet another exciting Foxy event where the experts in the field going to be discuss on one of the important topic, that is orgasm. Now, this orgasm has a numerous definitions and different understanding. It is a very sensitive terminology and it is connected to each one of us very emotionally. However, there are a lot of myths, misconceptions, and doubts are floating around it. So the objective of today's event is to understand from the experts in a better manner. So let's understand orgasm. So for the same, I would like to invite and welcome the moderator for today's session. The next slide. So we have with us Dr. Apurva Kumar Datta. He is a gold medalist and associate consultant from Sri Durga Clinic and Fertility Center, Dhanbad. He is a national coordinator for FOXIS, CMEs and workshops for safe abortion and contraceptive care 2020. He is a coordinator for FOXIS Sexual Medical Committee, that is for Jharkhand and Bihar, and the public awareness in charge of the committee. He is also an executive member, founder member of Jharkhand State Chapter of International Spina Bifida Foundation. He also been invited as a faculty in many national and international conferences, and he has published many papers. During his journey, he also received several awards, like Dr. Kamini Rao Yuva Orator Award in 2020, the National IMS Community Service Award in 2019, again a Foxy Young Turk Award in 2019, and the journey continues. Along with him, we have another moderator for today's session. So we have with us a young, dynamic, and experienced obstetricians and gynecologists with us from Guntur. That is Dr. Mohammad Shama Sultana. He has done a PG diploma in ART from Germany. He also has done fellowships in basic USG, endoscopy, and IOI. He is working as an obstetric gynecologist at infertility consultant at Open Hospital. He's also a gynec consultant at Star Hospital. He is also chairman and co-founder of Hope in Hospital, Guntur. I welcome both the moderators, and with that, now hand over the session to them. Dr. Apurva, can you please take it ahead?
Yeah, thank you so much. So thank you for coming here and giving us the time. I welcome you all from the Sexual Medicine Committee, FOXY. And today we are heading with this public awareness program, the topic, Let Us Understand Orgasm. It is a unique program, which is basically not only toward the, for the medicos, but to the general public. So before we start this program, so can I have the Foxy theme video? Yeah, please play it.
Dear friends, Foxians and women of my country, I am Dr. Shanta Kumari, President of the Federation of Obstetrics and Gynecological Societies of India. As a little girl, I told myself that I have to become something to make a difference. I always believed that if I desired something wholeheartedly, there is a positive force which makes it happen. And here I am, friends, standing in front of you as the 60th President of FOXY, the 38,000 strong committed body of OB-GYNs taking care of women's health in our country. As a young girl, I realized that women play a key role in this world, just like Mother Nature or Stree Shakti as we revere it. It is a guiding force behind all forms of God's creation. And it's only a woman who can actually create a new life.
Hi, I'm Kareena Kapoor Khan and I'm so happy to be here with you, if only on video. Pregnancy is a beautiful experience and I have loved having my babies. I congratulate Dr. Shanta Kumari as taking over the 60th president of this eminent organization.
Stree Shakti is the embodiment of 5 elements: the sky, the air, the water, the earth, and the fire. Any imbalance in any of these 5 elements creates chaos and calamities. Similarly, when a woman's health is neglected, it disrupts the universal equilibrium. The intimate link between environment and human well-being is very well known. With increasing awareness of the need for clean water, pollution-free air, and pesticide-free food.
Hi, I'm PV Sindhu. Well, it's such a beautiful feeling for me to be an empowered girl, to be a girl in a nurtured and a safe environment.
Protecting health by preserving nature and its ecosystem is easier than curing any disease. So we have taken up the concept of minimizing the female morbidity and mortality and fetal effects by mitigating the adverse impact of environment. My theme this year goes beyond FOXY's commitment towards women's healthcare. FOXY for all, always.
Foxy for All is another inspiring campaign. What you do in this organization
Okay. So after this inspiring video, let us start our program. And it's my great privilege to invite none other than but the chairperson of our committee. And this whole program is the brainchild of sir, and this program will definitely not see the day of a light without his constant support and without his guidance. So Neeraj sir is the chairperson, Sexual Medicine Committee, FOXY. He is the vice president at present, Rajkot Menopause Society, and past president, Rajkot OBG Society. So over to you, Neeraj sir, to give us the blessings and start this ceremony.
Thank you, Apurva. Good evening and welcome to yet another session of Dr. Parag Patil Memorial Public Awareness Program. This is done jointly by Sexual Medicine Committee and Public Awareness Committee of FOXY to deliver right information about sexual health and to remove myths associated with the sexual health, where people can directly ask their doubt about the topic and solve their queries. In today's digital world, lots of information are flooding, but not always true and scientific information people are getting. So we are doing this awareness program since last 1.5 years with the Zydus Proteasa people. And program is done basically in our loving memory of our late friend Dr. Parag Patel. We are committed to remove taboo associated with the sexual health. Today we are going to deal with the one complex subject, that is orgasm. Orgasm have a multiple potential health benefit due to the hormones and other chemicals that released by it in the body during an orgasm. So let's understand about it from our expert today. And luckily we are today is the 2nd September, and on the 4th September there is a World Sexual Health Day. World Sexual Health Day is an awareness day managed by the World Association of the Sexual Health, a global advocacy organization committed to promoting the best practice in the sexual health. It is celebrated annually on September 4th, an attempt to break down the social and cultural taboos associated with the sexuality and to promote positive sexual health around the world. This year, the theme is Turn It On, Sexual Health in a Digital World, which inspires the need to awaken the awareness about the sexual health right, while also recognizing the harms and violations of the sexual right in this digital sphere. So without wasting much time, let us move straight away to our program about let us understand about the orgasm. So over to you, Apurva.
May I invite Dr. Shama, my co-moderator, to introduce our
Good evening,
guest for
everybody.
today.
Good evening to the special program. So I take a privilege to invite our honorable chief guest and honorable Vice President Foxy, Dr. Archana Verma ma'am. She's passionate about creating awareness on women's health, and she's a Vice President Foxy 21, MD FICOG, Associate Member of RCOG, Founder President of West UP ISOPAR Chapter and Advisor COG, and Organizing Chairperson UPCOG 2020, Past President Ghaziabad and OG Society, Organizing Secretary NZY Foxy 2016 UPISAR, Organizing Secretary Midterm UPCOG 2015, Chairperson Public Awareness Committee Foxy 2016 to 2018, Member Rotary Alliance ECTA, Udan BVP, faculty in 600 plus national and international CMEs, and awards are Indian Book of Award winner, President Foxy, Best Committee Appreciation Award, UP Governor RTI, Uttarakhand Governor Appreciation Award for menstrual hygiene, Appreciation Award from CRPF Director for Health Programs 2019, Abdul Kalam Excellence Award, B First 3 Award, Women of the Year Health Award from IAS Wives Association, Wonder Foxian Award. So this is ma'am's achievements, and maybe these are less, few more are to go. So ma'am, I welcome you to our special program, Dr. Parag Patel's Memorial Public Awareness Live CME come question answer session. Over to you, ma'am.
Thank you, Dr. Shama Sultana. And I really love the name Shama Sultana because this is a year we are looking for want all women to feel like Sultana, and Razia Sultan was another like this. So thank you very much for such a nice introduction. And really today it's a unique program. I think CV hata do so we can see. So today, I really congratulate the Sexual Health Committee Chairperson, Dr. Neeraj Yadav, and Public Awareness Committee Chairperson, Dr. Kalyan Barmate, because this is something we really need to talk about. There are certain issues in especially married couples when they are just having a lot of issues in their married life, and the word happiness when they are looking for, then what is lacking behind there and what they are expecting, because sometimes they have in their mind all those Bollywood type of dreams, and they read all sort of books and then they find some differences. They just start sometimes feeling unsatisfied also, and then both the partners, they start faking, and they are just maintain the relationship. They just don't tell each other, they don't communicate with each other. And they because when we know as a woman, when we talk about the woman wellness, we need to talk about each and every aspect, right from her mental health and the all kind of a social health, and the reproductive health and sexual health is one of the important, very important aspect. And in India, though we know that the problem is not so much just talked about, but still whenever a patient comes in, they are a little bit of depressed. So somewhere in their life, this thing is namak kam hai, चीनी कम है, so that this kind of a feeling उनको अंदर से होता ही है. तो अगर आप उनको देखें तो उनका जो way of just experiencing life is totally different, and they keep saying ऐसा लग रहा है हमें हर आदमी सुखी है और बस हम ही दुखी हैं. So they go to untrained that I want to say in Hindi, they go to so-called sexologists, and that on the every roadside they मिलें तो सही, देखें तो सही, आइए तो सही, and they get trapped there. So if they start we wearing and alerting our patients, so alertness and awareness is really very, very important. And so they will be getting a better treatment. And today you have arranged a very good speaker, and so I congratulate you all for the great faculty. Thank you very much. Thank you, Apurva. You are doing wonderful work, and you are one of the very shining star of the Foxy, I must say. Dr. Neeraj Yadav and Dr. Kalyan, आप लोगों का जितना तारीफ करें उतना कम है. And this today Dr. Parag Patil, I want to say मेरा नमस्ते उनको, वो जहाँ पर भी हो वो बहुत ठीक से रहें, और उनकी सबको जिस तरह से वो he was really a great person, and we all remember him like anything. It's not he's in our mind, so you people are making him alive along with all your memorial talks. So this is something really wonderful. Thank you, Neeraj Yadav. Thank you.
Ma'am, so with your permission, we will release this month's newsletter. Now it is called E-Digest.
Yeah. Pehle, please stop sharing. Yeah.
Dr. Archana, we have one public E-Digest, so we have to release this today with your hand. So please bless us.
Oh, I just saw it. It is wonderful. I was going through in this WhatsApp, I could see, and so really it's a wonderful thing. This newsletter, and that you have whatever the message written from Dr. Vijay Sarthi Ramanathan. I'm really congratulate you people that you have called such a wonderful speaker, and you have given it in writing also, so everybody will be benefited. I really congratulate you. You please say a few words about it, Dr. Neeraj and Dr. Apurva.
Thank you so much. Neeraj sir.
Many congratulations.
Basically, we are releasing this newsletter, so it can be reached to every public, and they can read at any time in their mobile and get some basic information about the topic.
I think this should reach to each Foxian firstly, because it is really very nicely written.
Yes. So we also put it in the Foxy website also. Each of the our public awareness newsletter are there on Foxy website, and we also send to the all society president as well as secretary the copy of this PDF. So they can.
But this is really, Dr. Neeraj, this is something very simple to send. So send to all Foxian secretaries WhatsApp and email.
Yes, we always do that.
Okay. Thank you.
Thank you,
And
ma'am,
the best part of this e-newsletter is, ma'am, e-digital is that it doesn't contain any technical words. It is in a simple written form, and even the non-technical and non-people can read it, ma'am. So this is
even I heard only 1 or 2 lines from Dr. Vijay Sarthi. It looks very impressive. I think you need to really do a hybrid meeting for patients also, and you people can show the videos, and really very good. I congratulate you.
Thank you.
Thank you, ma'am. Actually, what I thought is with these e-digest, which are so simple to understand the topic, I thought to make these videos of regional with regional language. So
So that is required. That is needed now. That is needed. Each good teacher or a good speaker should make understand each and every word in such a nice way that they are picked up.
yes, thank you so much, ma'am.
Okay, so it's the time to invite our faculty. And before that, somehow what you have told about Archana ma'am, about the CV, and definitely there is a lot of things about ma'am which is not in the CV. Ma'am is always, sees the, power pack, and I think all of us, the young guys are actually get a lot of inspiration from her. And she is always, make us so, she's always available. You called her at 1 o'clock in the night and she's there and say, "Ha, pur bol, kya problem hai?" So, ma'am, thank you so much. She is so humble, so down to earth, and so helpful to everybody. Thank you to coming here and giving your precious time, ma'am. Thank you. Thank you so much, ma'am. To introduce Vijay sir, can I have a slide, please? Though I doesn't need the slide of Vijay sir. Vijay sir is a very senior consultant in the sexual medicine. He is the accredited psychosexual therapist and educator. He is the lecturer in the sexual medicine at University of Sydney, Australia. She obtained a triple uh, postgraduate degree from the University of Sydney, including PhD, a fellow of European Committee of Sexual Medicine, a registered medical practitioner in India, coordinate a team of psychiatrists, psychologists, and psychotherapists, and provide the sexual health care in India through an e-health platform. And definitely, he's a just a hardcore accommodation. So thank you so much, Vijay sir, to accept our invitation to be faculty of this, of this awareness program. So thank you so much. And I think we should start our question and session, which we are getting from the general public about this. Let us discover what is orgasm. So can I have the slides?
Yeah. Yes. Before that, a few words from our faculty member. Sir, over to you, sir. Vijay Sarvi, sir.
Yeah, thank you, Dr. Jadhav, and thank you, Dr. Datta and Sultana, and also Dr. Archana Verma, ma'am. Thanks for having me, and to the sponsors today. Look, I think it's a very important thing what we are doing today, and how this is different to a lot of information that is already there on website. So Dr. Verma, ma'am, was making an observation. And I think, Dr. Sultana, you were telling the information in the newsletter, it's very easy to read and understand. Now, that is what we call sexual health literacy. Now, there is today in 2021, there's plenty of opportunity to go read information. So there is no lack of knowledge. But how to use that knowledge in our day-to-day life is what missing. And that is what called health literacy, and that's what we are addressing today, trying to convert a very complex information into something that people can go use it in their day-to-day life, right? So thank you for organizing this session.
Yes, thank you, sir. So
Thank you.
will, with your permission, we will start our question answer session.
Yep.
I'll share the screen.
So, sir, whenever we are talking about the orgasm, actually, I particularly find this term, it is actually very, very misnomer. Even when people are searching in the internet, because this is the main source of getting the sexual knowledge. So when the people are saying there's a lot of definition that what is actually orgasm, there's a lot of myths around it. So before I start that, what is the orgasm? So just I wanted to know, and to our viewers, just can you tell me what is actually the sexual response cycle?
Okay. So sexual response is the way we respond to sexual stimulation. Okay, so a particular thing or a particular person or a particular object, when we see it or feel it, the body starts responding in a particular way. But it's important to understand it's not just the body, it's also the mind that is start processing in a particular way. Now, saying that, if there is a sexual stimulating object or if there's a sexually stimulating person or image, it doesn't mean it will have the same effect on two persons looking at it. Okay, for some, a particular image could be highly arousing, will be highly positive, whereas for someone who had a negative sexual experience, a traumatic sexual experience, that image of two people or more than two people having sex could actually trigger negative thoughts, because that will surface some bad or negative emotions in them. So how our body responds, and when I say body, the mind is also within the body, and it's important for public to understand the main sex organ for both men and women, or anyone for that matter, is the brain. So the main sex organ is between the two ears and not between the two thighs. Therefore, the brain plays a very important role, and how the body and mind responds to a stimulation, that's what we call sexual response. Now, the word cycle is also very important to understand, because initially we thought it starts with excitement, it goes to plateau, and then we reach climax. But that linear model, which is what a lot of men are supposed to respond, we are always ready for it. When we see a stimulation, we get excited, we reach a plateau, and then we climax. Whereas women, the female sexual response is always portrayed as more cyclic. Okay, but what in 2021, we cannot be black and white like that. Not all men are linear, not all women are cyclic. Okay, the notion is women need to be sexually interested. Once they get aroused, then they respond to sexual stimulation in a better way, whereas men are always ready for sex. That's a notion, that's not necessarily a fact. So cycle is a cyclic process. That's why they call it a sexual response cycle. Mhm. You need to unmute.
Yeah. Definitely, sir. Thank you so much for giving us this elaborative state. And this is that the benchmark are very important. What you have told, that the sex organ is not what between the two legs. It is between the two ears. So this is the benchmark, and this is the definitely take-home message. And this is all about a sex cycle. So we should move to our next question.
Yes.
Dr. Sama.
So our next question is sexual climax and orgasm. Are they same?
In a layperson term, yes, you can call them as same, but orgasm, we need to be very mindful. For a man, okay, in a men, we always think orgasm, the climax is the final act. But how do we know that's a final act? Okay, so it is a sort of a blurry area. Now in men, when a man ejaculates, that's when we call it as climax. All right, but what we need to understand is a man can still reach orgasm without ejaculation. So in that case, where do you draw, when do you say as climax? So we don't have to worry too much about the term, but what we need to understand is orgasm and ejaculation, meaning the semen coming out, happens very closely, almost like this in a man. But technically, they are two separate processes. You need to be very mindful of that. For some who cannot produce semen, meaning the prostatic issue or some issues where they cannot produce the fluid, the white color fluid that comes out, it is very frustrating for those men where they can feel that the peak sensation, but they cannot release any fluid. And that can be very frustrating for a lot of men, especially those who have experienced ejaculation, but now they're not able to see anything out, can be very frustrating.
So, very nicely
Yeah.
explained, sir. Yeah.
Mhm.
Dr. Shama, you have to unmute yourself.
So thank you so much, sir. All what are you saying is like a movie going before my eyes. A man sitting and he's now experiencing a lot of agony. Everything is before my eyes. Your explanation is awesome, sir. So the next
Thank you.
question.
Yeah, so moving to our next question. Sir, what you have just told that the sex organ is not between the two legs, but between the two ears. So the question is whether this orgasm is a whole body phenomena or just is only a factor or it's a phenomena of the urogenital system of male and female. So
That's
what's
right.
your view about it?
That's right. It's not about orgasm and a whole body phenomenon. I have an opinion, and I'm very confident in saying this. In a sexual situation, the whole body is a sex organ. Okay? Now, but if you start thinking, in my clinical experience, when I ask patients, okay, what's the main sex organ? 9 out of 10 people would say, oh, the penis or vagina, where I challenge them by saying, no, it's not about that. The brain is the main sex organ, and all other parts of the body responds what the brain triggers. So in that sense, let's start by acknowledging the whole body as a sex organ. And it's true. There are a lot of couples, by practice, by habit, when they get into a sexual situation, they like their routines. They go to a certain position, they will start with the same act, and they will end with the same act on the same bed, on the same time of the day. It's become a routine. And sometimes we call them as lazy lovers. They don't want to try anything different. Whereas when the whole body is a sex organ, there is plenty to explore and plenty to play with. And there are so many parts of the body that doesn't rely on erection. Okay? So erection, the penis in a man, erection, you need a blood supply and everything. But in order to lift your finger, you don't need blood supply. Yeah? So you can use your fingers to stimulate your partner. Now, saying that, there are 5 senses in the body. Which is the most powerful sense in the body? Apurva, do you know that?
Smell?
Proprioception.
Acha, proprioception. Okay.
Right? So in that case, the touch can be very powerful, and therefore, when orgasm happens, it is experienced as a whole body. Okay, because there is changes happening all over the body, because wherever the blood flow goes in the body, there will be some effect. But when we are engaged in sex, we are narrowly focused on a particular parts of the body. We either get fixated on the breast, or we fixated on the penis, we get fixated on certain parts of the body. But technically, it's a whole body experience.
Okay.
Yes. Thank you, sir.
Yeah.
So our next question is like the same thing we are talking
Same
about.
thing, yeah. I think
Role of brain in orgasm, and is it the main sex organ?
it's
Absolutely.
already answered.
I answered, but I would like to add a few more words on that. Okay. So brain is not just the command center. Okay. So brain, like, brain is like Foxy, and all other parts of the body is as local regional societies, but Foxy is the brain. Okay. Likewise, in sex, the brain is the command center, but it also releases, it commands release of so many other chemicals and hormones in the body that all act towards orgasm. Those are very important for orgasm. Now, brain is not just a structure, but we need to understand the function of the brain is called mind. We need to understand the difference between the two. Brain is a structure in the body, whereas mind is how the brain functions. Now, mind is what remembers how we experience orgasm the first time. So the brain as a structure is the command center, which influences what the body releases. But also the mind is very, very, very important, because how we have experienced orgasm from day one. And we get to learn from our own experience. If a man who masturbates using his left hand by sitting down, and that's how he knows, that's how he has learned how to reach orgasm, then probably that is going to be very important when he has sex with his partner, how he is going to translate that. And there will be challenges if somebody has experienced orgasm in a very particular way, they might have difficulty in doing it in other ways. So yeah, brain and mind are very important.
Yes. Yeah, that's what in breakups and all, in few of the movies we see that they don't have erection or anything. Like that in few movies we see, as you said, as a partner, with a partner, if they do, or with others. So yes, sir.
That's
Thank
right.
you. Thank you.
Mhm.
The next question.
Yeah. So moving to the next question, sir, we already have taken, and there's always a myth that yes, the orgasm in male are actually you are getting in a very early, or probably the females are not in that position, and the male already get the ejaculation and getting the orgasm. So there's a lot of myths about the orgasm in female. So the first question is orgasm in females is a myth, or does he actually has the orgasm?
It is definitely not a myth. Okay. So I would like to say, who said orgasm in female is a myth anyway? It must be some very male dominant opinion. Okay. Because when female orgasm is acknowledged, when female orgasm is appreciated, it somehow puts pressure on men. So it could be the insecure feeling of men that would have made it sound that orgasm in female is a myth. Okay, so let's not talk about that in 2021. We are talking about gender equality here. So that should not be addressed, and I categorically deny that orgasm in female is a myth. Is a myth. Okay, so definitely it's not. But let's look into deeper. Orgasm in women, actually, if you look at the tantric sex and a lot of ancient Indian scriptures, orgasm is actually addressed. Okay, the both Shiva and Shakti, the sound of Om, and there's lot of scriptures and writings and acknowledgement of orgasm in women. But then probably during the Puritan, the Victorian time, when lot of sexuality was made into a taboo subject, I think that's when orgasm in women could have been promoted as a myth. I think Dr. Neeraj Jadhav has raised his hand. Dr. Jadhav?
No, sir. I think probably it was my mistake.
Mistake. All right. Yep.
Okay. Thank you, sir. Yes. The next question is like, what is the sign of female orgasm? What is a fake orgasm?
Okay, so sign of female orgasm, when we say sign, it's somehow in a medical term, we think sign is something we find. Okay, symptom is what the patient presents. Okay, so when we say sign of female orgasm, we need to be very mindful. Orgasm is a very subjective experience. Okay, and as I said before, each one learn how to experience orgasm in a different way, depending on how much opportunity we had, what sort of liberty we had when we are growing up, whether we were able to explore sexuality, whether we were able to. A lot of women haven't even seen their own genitalia. Yeah, I'm sure in gynec practice you'd have come across. A lot of women haven't even seen, whereas men are somewhat fortunate that they are able to see their genitalia. And a lot of women haven't even touched their genitalia. Okay, so therefore, how they process orgasm can be very different, and it's a very subjective experience. But if you look at some clear definitions, okay, the heartbeat goes up, the flushing happens, and then the sounds that's being made, the body tense that happens, and then if you look into a MRI scan, or if you do some imaging, then you can see the tenting of the pelvic floor. You can describe all of that. But in a real world setting, how do we know that this is all happening? Now, in order to study this, we need to be able to witness in a laboratory, in an actual see what's happening. But ethically, that's not possible. We can't be doing human studies in 2021 witnessing what happens in orgasm. Okay, so we need to go by some basic scientific knowledge, but be mindful there is no definitive sign that if this happens, it is orgasm. That's not necessarily true, because there is quite a variation in how each woman experience orgasm. Fake orgasm is sometimes women are forced to fake orgasm, and sometimes they fake orgasm for fear. If I don't orgasm, my partner won't, appreciate me, or I have to fake it so that he stays with me or he will love me. So there are a lot of reasons why they fake it. But can it be faked? Yes, because in women there is no clear objective measurement or objective event that happens around orgasm, as in men where ejaculation happens. But remember, ejaculation and orgasm are two separate events, but it happens so closely, whereas in women there is no such event happening. So it's very hard for a man to fake orgasm, but a woman it is easier. But I'm not telling that women do that, but yes, technically it is possible.
Yes. Thank you, sir.
Thank you so much. So coming to our next question, sir, because as a gynecologist, many times when we are getting actually the infertile couple and we investigate it, and actually, after all the investigations coming to be normal. So many times they ask us whether the female orgasm is necessary for the fertility or to have a babies or not. So what's your opinion about it?
Okay, probably I would like to start from where the way you asked, Apuba. Probably we should start using the term couples with subfertility rather saying infertile couples, because a lot of couples do fall pregnant. So it's sort of to be mindful not to say them as infertile couples, because at some stage they might fall pregnant. And a lot of times you're spot on. They don't know how to have sex, or they may not be doing it the right way. So technically they don't even qualify to be called as infertile or subfertile. Now, anyway, going back to your question, is female orgasm necessary for fertility? Absolutely not. Because there is no clear demonstration that orgasm, it facilitates, it is an added thing, could be, but it is not a limiting factor for fertility.
Yes. Okay, sir.
Yeah.
Okay, thank you.
Because if orgasm is necessary for fertility, how on earth we are able to get fertility with IUI and other techniques?
Yeah, exactly.
Okay? So it's spot on. We don't need it. Okay. But also there is another myth, which I think. Okay. Yeah. That's fine. I'll wait for the. Yeah. I'll tell that later.
Okay.
Okay, sir.
Some over to
Vijay, I want to ask one question. What are the advantages?
Yep.
Yeah. Apurva, one question only.
Yes.
What are the advantages of having orgasm? Just for
Okay, the advantages of having an orgasm is you're able to finish of what you have started. Okay, say for example, we start a Zoom session, which is great. We started with the video and the talk of Dr. Shanta Kumari and Foxy video and everything. But imagine if this Zoom session continues to go on for 3 hours. Who will be interested. So anything and everything, even however good it is, anything that starts have to end. And that end process is what orgasm. And that's the benefit. So you want to end with a positive feel, and then it has to come to an end. Otherwise, even though erection, the arousal is so great, we cannot be having it for a long time. It becomes counterproductive. But what are some of the benefits of orgasm? Because when orgasm, there are certain chemicals, dopamine, there are certain chemicals that are released, which gets that sense of euphoria. You feel nice, okay, which is a nice thing. But that's what makes a lot of young people get confused. Oh my God, I masturbated. Now I'm feeling very sleepy. I'm feeling very tired. Have I lost energy? That is not true. It is the effect of orgasm that you feel nice. Yeah. So that's
Okay.
one of the benefits of orgasm.
And what are the disadvantages of not having orgasm? What the harm it can cause if one is not having orgasm?
I think the harm of not having an orgasm is that you feel like you're not able to get a sense of closure.
Okay.
And especially for men who have had prostate surgery, who cannot ejaculate, or even men who have retrograde ejaculation, where the semen comes and then gets inside the bladder, they feel like they've done something, but nothing can be seen out, which can be very frustrating. And then when they go for a pee, it comes out in the urine. Okay, so it makes it very frustrating for them. Okay, so not having an orgasm, there it can create a lot of distress and dissatisfaction for the man or a couple. Mhm.
What about female? Because as you know, okay, in Indian
Mm.
people, lots of women are not having orgasm. So what can
Mm.
be lead to that?
Okay, that's not
Exactly.
just in India, Neeraj. That's across the globe. I think a lot of women don't experience orgasm, or they might experience something which they don't recognize as orgasm. And women not experiencing orgasm, once again, they get started on, but they don't feel like it has built up to a certain level and got a closure. So that's what the issue. It doesn't matter whether it's a man or a woman. The process of orgasm is still the same. It's an arbitrary cut line. It's in the sexual response. It's when the sex starts to come down. So it's that transition that is very important. There is no medical consequences. If you don't have an orgasm, there is no medical problem. If you don't have an orgasm, that's not going to impact on your fertility. But still, that sense of closure is very important.
Actually, sir, I have read I think few months back an article, and whether it was said that if you get the orgasm and you have a good hair, good heart, your heart will be there. And is actually is it there is a scientific basis for that, or it's just a myth?
I wouldn't call it as a myth. It's an opinion.
Opinion.
Okay. So somebody who's involved in sex, they're doing a lot of sex, they get the arousal. I think that is a good exercise. Whether it ends in orgasm or not, it's a good exercise, and that will keep the heart healthier. Now, so in other words, to challenge you, Apuba, if a person smokes, doesn't look after his metabolism, doesn't exercise, does a lot of snoring, alcohol, and still have plenty of orgasm, doesn't mean this heart is going to be healthy forever. Okay, so we need to switch it around and think from the other way. Yes, it could be an added benefit, but does it have an independent influence on cardiovascular health? That is what we need to be mindful of.
Yes, okay, sir. Thank you. And this question, is it necessary that a couple to have an orgasm at once to have a healthy baby? We have already said that in IUI cases, IVF cases, isn't it orgasm is playing the role for making a baby? So anything you want to add on this question, sir, or we'll take next question?
Well, I want to add one more thing. This is a very, very important question because this creates a lot of tension in couples who are trying to fall pregnant because they put one person, especially if a woman has this notion that they both have to reach orgasm at the same time, it puts a lot of pressure on the man. Okay, because what if I come too quickly, what if I reach orgasm quickly? So they're trying to juggle in their mind, how am I going to prolong this? And for a woman, on the other hand, if they think that if orgasm doesn't happen at the same time, then it's not going to be a healthy baby. So they're trying to think about this in the mind, and actually they're not being able to enjoy sex as it happens. They are too worried about what's going to happen after sex, which impacts on how they enjoy sex.
Yes, sir. That's
And
right.
also there's a lot of expectation that the penis should go completely inside. It should, the sperm should be released close to the cervix. They get all this notion, and it's fine if it happens, but once they start making it as a condition, and when they don't meet the condition, they feel very worried about it, and then it becomes a negative cycle.
Yes, sir. Thank you, sir.
Mhm.
Purpa, sir. Next
Yeah.
question.
So moving to next question, sir. We are talking about the orgasm, its importance, and it's a female and the male aspect. So I just wanted to know from you, what is the process of orgasm? Is it the same in the female and the male, or it's the different?
Okay, so both in female and male, the process is almost the same. Okay, so orgasm, as I said, it's when the arousal happens, it's the peak of the arousal. But where does that peak happens can vary from person to person. So some literature addresses orgasm as a own, it's a different process. But some definitions, some people see orgasm is not a separate entity, but it is only a continuation of the arousal process. Now, what happens is you get built up, built up, built up, and at some stage it stops and goes back to normal. That is called orgasm. Yeah. But when the build up doesn't always happens like a steep curve, sometimes the build up happens, you lose it. Once again, the build up happens, you lose it. And that can sometimes be considered as multiple orgasm. But that's not necessarily multiple orgasm. It is just a small staggering orgasm. It's a sequential orgasm. It's not it's one orgasm happening in small intervals.
Very nicely explained, sir. So next question, Dr. Sama.
Yes, sir. What is dry orgasm? Is it a real orgasm?
Okay, dry orgasm, I think I've already explained it. It's when in a man, dry orgasm is when he feels everything the way he has remembered orgasm, and he has always remembered orgasm equal to ejaculation. Because remember, it two separate processes but happening very close to each other. In dry orgasm, he is able to feel everything but not able to ejaculate anything. And this is very common after removal of prostate or prostate cancer or benign prostate hyperplasia. So they were not able to ejaculate anything. It is still orgasm. Remember, orgasm is orgasm. There is no ejaculation associated with that orgasm. And it can be very, very frustrating.
Sir, I got, I think till now 3 cases of anejaculation.
Yeah.
Where the patient actually come with me with a primary infertility, and the problem is that there is an ejaculation. So so when I took a detailed history, and then what he told, yes, he gave that feeling, but he doesn't have that wet orgasm. So this is one thing. And probably I advise her to go for a urologist to have some, surgery, because there may be some defect in the, outflow obstruction. So probably
Okay.
he is not getting that.
That's right. But you need to understand, Apurva, we need to be very clear whether an ejaculation happens only during sexual intercourse with his partner, or does it an ejaculation even when he masturbates. It is very common. Men able to ejaculate perfectly fine when they masturbate, but when they have sex with a partner, they're not able to ejaculate, because remember, they have programmed to reach orgasm in a particular way, with a particular position, with a particular friction, and that cannot be simulated in a vaginal sex.
Correct.
And also, you need to differentiate between delayed orgasm or delayed ejaculation and an ejaculation. Okay? Because a man can have sex for 30 minutes and still not able to ejaculate. But once he comes out, go masturbate, he can ejaculate. So that's technically not an ejaculation. That's a delayed ejaculation. Yeah? It's all right. That's a separate topic on its own.
Yes,
So
sir.
moving to our next question. Sir, we often heard the topics about whether it is the vaginal orgasm, clitoric orgasm, or the G spot, or orgasm even without involving the, the genitopelvic parts. So what is actually these type of orgasm? Are these the same, or this is only theoretical and nothing related with the real things? So what's
Okay.
your view, sir?
That's right. So first and foremost, vagina is a tube and it does not have much sensation. So vaginal orgasm, we need to understand which part of vagina creates that heightened sensation. So when lot of men and women don't know what is clitoris. They think clitoris is that tiny structure, like I used to tell my patients, it's like the earlobe on the top. They think that's clitoris. I tell them that is not clitoris. That is called the hood of clitoris. So where is clitoris? So clitoris, it's like a butterfly structure behind the vaginal opening on either sides. So I have a picture that I show my patients. So technically, when the penis or any object that goes inside the vagina that creates that sensation, it is technically stimulating the clitoris. So it is absurd to say that vaginal orgasm is separate to clitoral orgasm. Vaginal orgasm includes clitoris. So I can't see how they even differentiate that. And there's been a lot of argument that vaginal orgasm is superior to clitoris because they believe that women cannot stimulate themselves. Okay, but the answer is vaginal orgasm or clitoral orgasm, there is no difference. It's one component. Okay, it's one big component. And G spot, and there are so many other spots. So I think every person can explore their own spots and see where it triggers them very much, rather having a theoretical understanding. Okay, if you go touch there, that is G spot, and why I'm not getting the sensation because I was told there is a G spot. I would say to my clients, forget about G spot or A spot or B spot. Whatever the spots that you can touch, be exploratory and see which spot triggers you, and that is the best spot for you. And I call that as the hot spot.
Very, very truly said, sir.
Yep.
So I think this answer, clarify a lot of myths about this type of sports and this type of orgasm.
Yep.
So moving to our next question, Dr. Sama. Over to you.
Yes, sir. Can orgasm be achieved without penetration?
Yes, a big yes. As I told, the clitoral hood is a very sensitive structure and which is very much equivalent to the glans, penis, and the frenulum. So it's sort of the same structure in a man. And orgasm can be achieved without penetration for sure. Okay, with direct stimulation, or some women even can experience orgasm without touching the genitalia. Okay, it can happen.
Yes.
Very truly said.
Thank you, sir.
So moving to our next question. Sir, this is a question actually a lot of people are asking, and I think this is one of the major, I think a lot of questions regarding this, which we club actually. How to get orgasm in female?
Okay, the question itself has the answer. Okay, when you put a question how to get orgasm, we somehow think it is something out there that we have to go get it. Okay, it is not a commodity, it is not a gift, it is not something that you can get, or in the other words, it's something you can give it. Orgasm is something that can be realized and experienced and felt. You cannot give orgasm. Okay, now technically speaking, you can have a same woman and have do this different things to get orgasm. It doesn't mean she's going to experience orgasm every time. Okay, and you do the same penetration, or you stimulate the same spot in 5 different women, there is no guarantee they all going to experience orgasm the same way. So there's a lot of variations, and if one thing doesn't help stimulate a female to achieve orgasm, don't give up. Remember, I told the whole body is a sex organ. Try different types, or try be exploratory and be creative. Okay, so for some women, the great toe can be very sensual. Okay, for some women, the inside of the thigh can be more sensual, and for some women, the genitalia is no longer a sensual part of it anymore. Okay, so it's important to be exploratory and don't be ashamed to touch your body and explore. And remember what we say to girls from very young age: don't touch there, it's a dirty organ. Is it a dirty organ? Absolutely not. It is an organ like any other part of the body. Something smelly comes through that organ, and urine is not necessarily the bad fluid. It's actually a very sterile fluid, provided you don't have any urogenital discharge or anything. It is still a sterile fluid. So to my daughter, I've never said it's a dirty organ. Okay, but you teach them, you don't touch it in public places, you teach the manners, but please don't give that sense it's a dirty organ. And that has got a lot of implications when they grow up into a adolescent or adult girls. Okay, so that's very important. And be friendly with your own body. Okay, I think that's very important, because the genitalia and the brain, if there is a big brick wall built, it's very hard to connect the main sex organ with the secondary sex organ, and that has got implications in how a person can experience orgasm.
Correct.
Yeah, and guess what, Apuba? What is the nerve that supplies the genital area? Shama or Apuba, do you know the name of the nerve?
It's a genitofemoral.
Pudendal nerve.
Pudendal.
Yeah.
Yeah, that's a branch.
What is the meaning of pudendal? Do you know that? Have you ever bothered to understand what pudendal nerve means?
No, sir.
Pudendal means shame.
Okay.
Okay, so they have even named the nerve that supplies that region as a shame.
To be shamed.
Okay, there is nothing to be shamed about it, and that is very important, how a person experiences orgasm. So the concept of getting orgasm or giving orgasm should be put aside. It's more about experiencing and realizing and feeling orgasm should be taught.
Wonderful, sir. It's actually wonderful. And what you have, sir, just touched it. What we are actually trying to get is the sexuality education. It is very important, because the problem which we are actually from the beginning we are saying that whenever we are getting this type of problems, we are actually getting the information from the internet, which are unfiltered. We are getting the information from our peer who are actually equally, equally knowledgeable like us. And that's the problem, and that's they are misleaded, and they got all the wrong information, and this problem is actually getting worse day by day.
That's
So
right. Now, just touching on that, Apuba, when a patient comes to me and if they don't know anything about sex, that's actually a blessing. Okay, it's like a clean white page. We can write from the beginning. But what I'm getting more and more is a person with lot of scribbling on a white page. So the first process is to go through all of that and erase it and then rewrite it. Okay. Now, for example, if they see pornography and the way orgasm is depicted in pornography, the whole body jumping up and down and creating sound, and when they don't experience that, that automatically makes them feel they have a problem. Or when the partner sees, oh, I saw in porn that person is jumping and bending and arching, you're not doing any of that. So do you really like me? Because human tendency is we tend to think sex is equal to love. Okay? If you love somebody, then sex has to be perfect and beautiful. If you don't have satisfying sex, that means you don't love me. But sex and love are two separate things. You can have plenty of sex with one person and still not love them, or you can love somebody so much and still don't have sex.
Very truly.
Okay?
Yeah. Beautifully explained, sir. Thank you so much. Now it's the time we should pick up the direct questions from the public, the cases. Okay. So over to you, Shama, to start the first question.
Yes. Okay, sir. So the question from the public forum is, I'm in a relationship from 3 years now, and every time my boyfriend have his ejaculation early, but I don't get satisfied from the act. I do masturbate later to get orgasm. How could it be practiced so that I get orgasm during the act?
Okay. First and foremost, in this question, why you assumed it's a heterosexual couple? What made you think the person telling the history is a woman? Okay, so we need to understand that. Okay, it could be a gay couple, it could be, we need to be mindful of that. Okay, but assuming it's a heterosexual couple, so relationship for 3 years, every time I brought ejaculation early, but I don't get. Now, what's happening is, a lot of times men can be very self-centric. They think sex starts when they get an erection and sex finishes when they ejaculate. They are very self-centric. Now, a lot of times what could be happening is this man is not spending enough time to respect his girlfriend's feeling. He's not interested in making sure that she gets a fair share of the enjoyment in the sex. Probably if that happens, then this thing can be solved. Okay. Now, in situation like this, if the man actually spends time or do things to make her experience orgasm, once the woman experiences orgasm, they really don't care how long a man takes to reach orgasm or ejaculate. This whole concept of premature ejaculation goes away. Premature ejaculation is a problem when the men start and finish and they walk away and go. Okay, this woman, she's been wanting it and she started it, and before she can even get anywhere, this guy has already finished and walked away, washed his hand and start watching TV, whereas she is still in the bed. Okay.
Yes.
But in this situation, she is most welcome to masturbate, and women can masturbate, and women are able to masturbate, and a lot of men don't recognize that women can masturbate, but female masturbation is a real thing and there is no shame attached to it, and it's their right and it's their sexual right to have pleasure from sex. It's one of their rights. Mm-hmm.
Very truly said, sir. This is actually what happened. Why not the female masturbation is so common in India? because I think it's maybe the common in India, but the sex toys are not freely available in India. This is one of the things I think we don't have freely available. So people
We
are not
have
having.
10, we have 10 sex toys in our body.
Yeah, definitely.
Okay. Okay. We don't have to rely on toys. Okay. Now, one point of caution I would like to say, it's great to use toys. Okay. But when we use toys, we need to remind it's only to enhance. It should not become a dependent on it. Okay. So say for example, you put some cardamom in a tea. Have you tried, do you put cardamom or spices in a cooking? But imagine we cannot make a whole lentil out of cardamom and spices. We cannot eat it. So like that, the toys can be an addition to what we already, the routine sexual act, but you cannot become too dependent on it. Okay. But masturbation with finger, we don't need to have a toy for that.
Correct.
And Dr. Vijay, sometimes problem is that there is a lack of communication between partners. So
Yeah.
they can't ask their partner to satisfy her after he finishes. So problem is most of the time due to lack of communication.
Absolutely. And also in a cultural setting, women asking for pleasure is seen as something dirty. You shouldn't be asking for it. You know, I'm the one who will give it. When I give it, I give it. You cannot be asking. And that's when the taboo, and they start labeling women and fearing that they don't speak up. So you're spot on, Dr. Jadhav. That's exactly right. Communication is very important. Okay.
Correct.
Yep.
So, sir, moving to our next question, next live question. I am 26-year-old unmarried woman, working woman with a very busy schedule, not in any sort of relationship, never with any sort of relationship. But whenever I am alone, I do masturbate and watch porn simultaneously to reach orgasm. Will it affect my fertility later? Now this is actually the same questions which we are getting from the male partner, that I do masturbate a lot. So is it affect my fertility? So this is in the female part that I am getting. So yeah.
Okay, there are two answers to it. The short, straightforward answer is no. It will not affect fertility. But how it can affect is if they start processing to reach orgasm by masturbation and using toys or porn, then if they not able to simulate that in an actual penovaginal sexual act with a partner, and then even then it's not a problem. But the real problem happens, okay, now I'm not able to reach orgasm because I've always achieved orgasm by masturbation, but now I'm having sex with somebody, I'm not able to feel the orgasm. Is there a problem in me? And that distress can cause problems in terms of fertility or general sexual health in general. Okay. And also you need to understand that orgasm is not a limiting factor for fertility. You can still become fertile, without orgasm. But I'm not saying that because you have experienced orgasm by masturbation, you won't be able to achieve orgasm in sex. You can still, but it might be slightly different, and you will be able to adapt so. Yeah? Is it clear?
Yes, sir, definitely. It's very clearly explained. This question.
Actually, I had a patient with a similar condition, a male who was watching all night porn, and he was getting orgasm with it. But now, after 4 years of marriage, also he is not getting the same orgasm with his wife. So I had counseled the couple for a few times, like 5-6 sessions. Still, he was matching that situation to his loss in his job and his financial situation, and that he was correlating with orgasm. So
that's right. See, it's easy to blame
that emotional stress that.
Okay, it's a very complex situation, Dr. Sharma, because it's easy to blame everything on porn. Okay, Now, the problem is not necessarily porn. It's a responsible use of pornography. Okay. If he's going to be watching all night pornography, then he's going to sleep late. He's going to wake up late. Or if he's only going to sleep for less hours, he won't be able to be productive and fresh at work. And it becomes a vicious circle. Okay. Now, when he watches porn, he won't just be watching porn just like that. He will be masturbating. And when he masturbates, he uses his hand. With hand, he can control the pressure. With watching porn, he can change what he watches every 10 seconds, whereas that cannot be done with a real person. Okay, so there are a lot of differences. Now, the worst thing is, it's not about him watching porn, it's not about him masturbating to the porn, but the thought whether I have done any damage to myself, whether I have a problem, whether I'll be able to father a child, whether I'll be able to satisfy my wife. This self-doubts, shame, and guilt is very cancerous. Yeah?
Yes, sir.
It's a complex
But
situation.
he has a really malignant thought that he will not, do the same with his wife. So
Yeah, that's right. It could be guilt, it could be shame, it could be a lot of other negative emotions. And I can politely say he needs a specialist intervention.
Correct.
And that sort of patients is what I see, the complex ones. None of my patients are straightforward.
yes, yes, sir.
Yep.
Thank you, sir.
Mhm.
So the next question.
Okay, so moving to next question. Yeah.
I'm 25-year-old postgraduate student staying away from my family. I often get orgasm only when I do use any vibrators. Is it safe to use vibrators or any other female sex toys?
I think
Absolutely,
this
yes.
is the same question. Yeah, repeated one.
Yes.
Yeah.
But can I give a word of caution here? Once again, using sex toys, treat like any other products. Make sure it's kept hygienic. Lot of women and men use toys, and once they reach orgasm, they put it in the cupboard and walk away. So you need to make sure you clean those toys, you take care of them, make sure you wipe it and keep it in a safe place. Okay, otherwise you don't know what you're putting inside. And also don't go for cheap stuff, because there are a lot of allergens, and we are also seeing patients using cheap brand toys ending up with bacterial infections and all those things. So be very mindful of it. Please do remember, when you use vibrator, the intensity, vibrators doesn't come with one intensity. You have the option to increase the intensity of vibration. That's great. But when you start having sex with a real person, or when you masturbate with your finger, do not expect the same. It cannot be simulated. So you need to understand, okay, Shah Rukh Khan can fight, can jump 10 cars. That's great. It's great to see a movie, but that's a movie. But reality is different. Once you have that maturity to differentiate, then anything is fine.
Beautifully explained, sir. Beautifully.
Yep.
Thank you, sir. So moving to the next question. I am an engineer and I was working from home since last year. Alone at home in my flat, I used to do multiple orgasms, which used to make me more tired and hungry. And are there any side effects of multiple orgasm, or are there any benefits of multiple orgasm?
Okay. First of all, just because they've asked a question about sex doesn't mean it's all about sex. You're an engineer, you're working from home since last year. I assume it's because of COVID lockdown. Are you looking after yourself? Let's talk about self-care. Do you do any exercise? Do you go out, get some fresh air? What you do to look after yourself is very important. Yeah, that's number one. Now, do you feel tired and hungry? Now, you need to understand how the brain processes. Anyone who's constantly working under the air conditioner, the brain starts to interpret thirst as hunger. That's why a lot of people working in air conditioned office tend to eat more, okay, to keep the basic metabolic rate, okay. So your tiredness and hunger might not be anything to do with orgasm. Okay, but because people don't talk about this topic, because they do think, they enjoy doing it, they somehow link everything to this particular habit of masturbation. It could be have nothing to do with that, but assuming it's orgasm, there is no side effects of multiple orgasm, and once again, there is no benefits of multiple orgasm either. It's just you enjoy, but don't make it as an expectation or condition that it should be multiple orgasm every time you have sex. It is just not realistic. When it happens, enjoy, but don't make it as an expectation or condition.
Sir, along with this question, many a time I was asked about this question, that what should be the frequency of sexual intercourse? Like how many sexual intercourse, there is a minimum sexual intercourse in a week, or how much is the maximum? So what about your thought about this?
Okay, what is the minimum frequency of doing physical activity, Apurva?
There is nothing like that, sir.
So there's nothing like that for sex as well. Okay, do it when you feel. If you start putting an expectation, if you start putting a condition, I should do this many times, it automatically creates an expectation. And when you're not able to do that, you get disappointed. It defeats the whole purpose of sex. Okay, do it as much as you can, but make sure that you don't get too dependent on it, thinking about it all the time. At the same time, don't come up with excuses for not doing it. Okay, now when is the most difficult time to do an exercise? What is the most difficult time of doing any form of exercise?
Sir, after eating, I think so.
No, the most difficult time of doing any exercise is the few minutes before you start doing the exercise. The moment you ask, shall I go check one email and come and do, you will never return to exercise. Okay, so yeah, that's it.
Thank you so much, sir. Thank you so much.
Yeah.
Okay, Dr.
Yes, sir. Yes, sir. So the next question. I'm a 30-year-old working woman. I have a satisfactory sex life with my partner, but I feel loss of interest after orgasm and it lasts all day. Is there any way to decrease my refractory period and regain sexual interest soon?
Good sex cannot exist in a bad relationship. Okay, so it's very important. You cannot have a bad relationship and then expect sex alone to be good. So we need to understand how the relationship dynamics is. So that's very important. Now, once again, we are assuming this is a heterosexual couple. Now, once again, looks like there is a conditioning here that I should have this many orgasms. Once again, the moment we start putting conditions, we might hit a dead end and we start feeling the pressure, and which will then actually kill the sexual interest. So that's one aspect. The other thing is, when people engage in sexual activity, they have a habit of doing the same thing again and again. They're not willing to try something different. And if you can do it, if you have the privacy to do it, sex doesn't have to happen in the bedroom. Okay, so it can happen in the couch. You can be creative, provided kids are not there. Conditions apply, but you can be creative about it. You don't have to lit 100 candles as they show in a Bollywood movie. If you have 100 candles lit, your mind will be thinking whether the curtain is going to get fire. But you can definitely put one candle. So be a bit more creative. And losing interest after orgasm, it's a normal process. Don't try to make yourself believe that you have a problem about something that is very normal. And I want to make an impression here. In my 13-14 years of experience, a lot of people have come to me thinking they have something abnormal. Not necessarily they have something abnormal. They did not know what is normal. Okay, so when we don't know what is normal, we start to believe whatever we experience is abnormal. In this particular patient or this particular case, she expects that I should have this much of a refractory period. I should be able to achieve orgasm. And when it's not happening, she's thinking I have a problem. This could be very normal.
Okay, one of my patient was saying like when their marriage was means a few months of their marriage, they used to have orgasm 3 to 4 times a day, but after few months longer, they had only once a day. Then
Yep.
once few weeks,
Yep.
at once in a few weeks. So
Yep.
is it impact emotionally or physically? How?
That's right, Sharma. Let's stay away from sex. When you buy a new car, you tend to look around the car and go for trips. When you buy a new TV, you tend to look at it for a longer time. That's human tendency. When it is new, we tend to spend more time. But once we start owning it, once it becomes part of us, there is no more that novelty in that anymore. Okay? So that's the human tendency. Okay?
Correct.
Yes.
That's right. So there's nothing different to sex.
Is the same happens refractory period it goes on increases? Or?
That's right. Either they become lazy lovers, okay, because there is no that then we call that a period of limerence. Limerence is when you see something new it happening, you put lot of effort, and some people do too much in the first few months and then go nothing. They start doing everything as though they have only 1 week to live in this world, and then they have exhausted everything. So that's where it becomes very important to be creative and don't be ashamed to have fantasies. Okay, so we haven't talked about fantasy at all in this whole session. Fantasy is a very important aspect when it comes to sexual pleasure and orgasm. Not every fantasy can be played out in real life, but there are some fantasies which are safe, which can happen within a couple. And try to, once again, like Dr. Jadhav said, communication is very important. If you have a fantasy, you can communicate to your sexual partner. You cannot force them, but you can do something together to make it interesting. Yep.
Yes.
Very true, sir. So moving to the next question. My colleague and I started a relationship since 4 months, and I tend to ejaculate faster and see need to get orgasm after a long foreplay, again, along with the masturbation. How can I prolong the duration of the sexual act? Is the vagina only way? I fear of its side effect, so please suggest a safer method. Sir, you have to unmute yourself. Vijay, sir.
Yep. Okay, so there are a lot of elements in this question. Now, PDE5 inhibitors, I'm not going to use the word Viagra, that's a brand name. So PDE5 inhibitors are a safer drug, so there's no issues about it. However, PDE5 inhibitors will only work when there is enough sexual arousal in the first place. PDE5 is not meant to create arousal. It only meant to create erection when there is adequate stimulation and arousal. So that's number one. And there is no big side effects except for the first couple of times you might have some headache and flushing, but nothing to worry. Okay, it's a safe drug all over. Now, the first part of the question is relationship for 4 months. I tend to ejaculate faster, and she needs to get an orgasm after long foreplay again. Now, that's fine. Now, if the two people in the relationship have an agreement, if they can communicate their likes and dislikes, if he tends to ejaculate faster, probably then he shouldn't be involved in the sexual act in the first place. Okay? And try stimulate his penis or whatever that stimulation that makes him come quickly. So probably he should be focusing on the female partner, do whatever that takes her to reach orgasm first, and then even if he ejaculates quickly, it's not going to make a big impact. Okay. But then we need to understand it's two people involved. We need to understand the each person's expectations, and we have to manage the expectations. Yeah.
Sir, actually, what I feel and this, like the 5 fingers in the hands are not the same. The same with happens this only. A person can't get orgasm or ejaculation. The time maybe varies. Like today evening, today just I finished my OPD and I came here for the webinar. One couple came us and the wife has actually, ये तो जल्दी गिर जाते हैं. And when I asked the couple, asked the female, that's what said, hey, it's around 8 to 10 minutes. Now I told them 8 to 10 minutes is absolutely normal, yaar. Actually, the problem is that they have what you have already told. They have a fantasy, like by it happens to be movie only. Everybody can't be, with Shah Rukh Khan going dishum, dishum, and dishum. It's only happens in the movies. So I think there is a lot of means and which you are dealing. It's a very nicely that this mood should be not be there, and everybody has a different thing.
That's right. I think when you take history and even for general public, always look for the term should. Okay. Every time you see shoulds, you need to really stop and think where the should comes from. Okay.
Yes, sir.
Yeah. Can move on to the next one.
Yeah.
So the next question is, I'm from Nasik, happily married last month and having a satisfactory sexual life, but still wanted to know, is there any sex position in which she can reach orgasm faster?
Okay. So you're happily married only last month. What is the need to reach faster? Yeah. So we need to understand, is the man asking a tip to make her reach orgasm faster? But then what if the woman does not want to reach orgasm faster? It has to be a couple. We need to understand why they are asking this. But I will give you an answer. There is no one position that is superior to the other. Okay. But technically, physiologically, anatomically, a doggy style has got a higher propensity to stimulate the clitoris so that they can reach orgasm faster. Okay, but this term faster is very disturbing for me. Why? Okay, and whose expectation is that?
Yeah, maybe the previous question, like he is ejaculating first and she is not able to get orgasm. Maybe in this case also it is happening.
Okay, so in that case, once again, men need to be admitting that I'm coming quickly. What can I do to delay, rather putting the blame on the female partner? Okay, so I think one message I want to give to men here is we really need to start respecting women as equal, and they also are human beings with sexual needs and expectations, and giving respect to those sexual wants. That's a very important take-home message.
And sir, here just I want to add one thing, because many times even one of my patients is asking me, sir, I have heard about clitoral hood enhancement, right? People are actually thinking that that many a time, because the clitoris is not well exposed, so clitoris hood enhancement may increase the orgasm. So just I wanted to say everybody that it's only for the cosmetic purpose, and it doesn't actually increase or decrease your orgasm. So this is only a myth, and this is only have the because people are knowing about the cosmetic gynae, and even so this clitoral hood enhancement is only for the cosmetic purpose only. That's it. Thank you.
Could be. Yep.
Yeah. So moving to next question, Dr. Sharma. So this is again, I think a very common questions we are getting in the OPD. Any medication to improve the orgasm disorder or improving the female sexual arousal? Is it safe to use? What is the use of fevaserine?
Okay. When we really don't understand what is orgasm, how are we going to define what is orgasmic disorder? Okay, so my take, especially given this is a public forum, I don't want to make a very generalized statement whether it is what drug to use, whether it is safe. I would say go talk to your doctor about it.
Correct.
Yeah.
Definitely. Yeah, because many a time it is due to only the might counseling will solve the problem. So I think these medicines are nowadays freely available in the internet and in the market. You should
Yeah,
not get these type of medicine from the market and from the over the counter. If you have any problem, please visit your doctors, ask and tell freely about what is going on, and then only if they prescribe the medications, you should take only after that one.
that's right. And
Thank you.
also remember, a medication cannot fix all of the problems. Yeah.
Yeah.
Yes, the same next question goes like Viagra, female Viagra treatment. Is there any role of this in case of treatment of orgasmic disorder?
Okay, so this has been an issue for a long time, and there's a lot of push to get the pink Viagra. Now, once again, it's a brand name. I want to be very mindful. Look, there is no conclusive decision on that. Okay, it's still in pipeline. But female activists would say, oh, it is sort of, the female sexual response is not given due attention like the male sexual issues. But yes, the concept is vasocongestion. So if you take it, there's a dilatation, there's an increased blood flow that can cause the congestion, which can create a better sense of arousal, genital arousal. But whether it has been FDA approved, I don't think so. It is, and I don't believe it will happen anytime sooner.
As you rightly said, sir, it's a multifactorial approach should be there to treat any patient. So taking this medicine by themselves will not be a safer thing. Going to a doctor and knowing the real cause of their orgasmic disorder will be the means known and perfect treatment for them. Thank you, sir.
That's it. And one other thing, during the menstrual cycle, it is often believed women are not interested in sex and because they are menstruating. But from a physiological point of view, there's a lot of blood flow. Okay, and if whether there is an opportunity to have a better sexual stimulation during peak menstrual cycle. Okay, that's something we need to look into it. I'm not a
gynecologist. I personally
gynecologist.
feel that in menstruation there are increased amount of feelings and orgasmic, triggers. So
Triggers,
yes.
but the shame is that's when they've been labeled as not to engage in sex. Yeah.
Yes.
So that's something we need to take into consideration.
Neeraj sir, you want to say? Yes.
Yeah. Regarding that, your question about the vaginal rejuvenation and lots of surgeries and procedures are done on the cosmetic gynecology. Is any way helpful to achieve better orgasm? We would like to know from Dr. Vijay.
Yeah. Look, I think any lifestyle of home remedies, I think the lifestyle is communication. Okay. Having a better communication, having a better relationship, and depends on how this person has developed sexually. Okay, how they have understood orgasm. And orgasm is not if a lot of women haven't experienced orgasm. Now, whether we are going to call that as a disorder and start treating them without any specific goal, I don't think so. That's the right approach. But I can't say any specific home remedies to improve orgasm. Okay. But what I can say is become more friendly with your genitalia. Feel free to touch it. Feel free to explore it. I think that is something can definitely help achieve orgasm. I don't know whether it will help achieve sooner, but definitely it will help achieve an orgasm or experience orgasm in a better way.
And specifically in the premenopause and menopausal, postmenopausal age, they are marketing like anything, these procedures and so
That's right. There's always going to be a commercial interest, but whether it is actually working, even if it working, is it only a placebo effect, which tends to fade off? We really don't know any of that. But somebody is able to afford it, somebody is giving it, there's no problem there. Okay, but yes, some remedies, some treatments are being ripped off. Okay, so patients are get ripped off, but their choice. Nobody's forcing them to do it. They are going and getting it on their own. Yeah, but
Thank you,
one
sir.
other thing I would like to inform, like remember how I started with brain as the main sex organ. There is one other sex organ in the body which lot of women and men don't understand or give importance. Can Shama or Apurva, can you think of what is that organ? It's not an organ, it's a structure in the body.
Skin.
Skin is more proprioception,
Definitely.
but this is a very powerful structure which we cannot see it outside. It's inside the body, but it means a lot for orgasm. It is very, very important structure.
Brain?
Brain is inside. We already talked about it. We are not talking about the external genitalia. There is one other structure.
Sir, breast?
Breast we can see, Apurva. I'm telling about a structure that we can't see. And this is a very important take-home message. The structure is like this. I'm giving a clue. Pelvic floor. Okay?
Okay.
Pelvic floor is a very, very, very important structure because all the blood vessels, the nerves, everything comes through the pelvic floor. If somebody who has a very laxed pelvic floor, especially after childbirth, they may not be able to feel the same tension, the build up inside. Okay? And those who have very tight pelvic floor, especially those who like masturbate, when they sit and masturbate, they tend to contract the whole body. When they tend to contract a lot, that can also cut the blood supply and can cause problems. So hypertonic pelvic floor or hypotonic pelvic floor, they both can cause problem. So I want to say, start with the brain and also think about your pelvic floor. Okay, but the whole body is a sex organ. Okay, that's what I want to conclude with.
Amazing take-home message, sir.
Yeah, definitely. And
thank you.
With this, definitely we finished all our questions, and I think this is the first time when we discuss about only one topic, orgasm, so deeply. And I think we have touched each and every aspect of orgasm. So thank you so much, Vijay sir, for this wonderful discussion. Sir, Neeraj sir, you want to say something?
Yeah, Sachin, is there any live question have you got?
No.
No.
I doesn't find, yes sir, any live questions. Actually, sir, what I think, sir,
Neeraj
Neeraj sir,
already covered in our questions.
Yeah, exactly.
We are actually doing, मतलब हम लोगों ने सोचा नहीं है कि orgasm के बारे में इतना 2 घंटे का discussion हो सकता है. We can discuss this a simple topic, orgasm, which I think everybody is saying that it is the climax of satisfaction, and we discuss each and every aspect of this orgasm, about the male orgasm, female orgasm. Even we are getting a lot of doubts clear in our mind. I think Sama must be very much agree with me. So thank you so much, sir, Vijay sir, to giving such a wonderful
Dr. Vijay is always a wonderful teacher, and it's like always like that we continue listening him, and he keeps on talking and talking. So it's never ending thirst like that. It's always wonderful to have you in our program.
Yes, sir.
So, sir, is it a time to wind up? I think Vijay sir is also exhausted by this exhaustive discussion, and we are trying to put all and every questions about it from you and extract each a little bit from about you. Sir,
so I want to propose vote of thanks.
Yeah. Okay, Sama.
Yes, no duty is more urgent than that of returning thanks. So I feel honored and privileged to get the opportunity to propose a vote of thanks. I especially thank our chief guest, Dr. Archana Verma ma'am, for giving her valuable time and her words of encouragement and guidance to this webinar. And we are very grateful to our speaker, Dr. Vijay Sarthi Ramanathan sir, for his amazing explanation to all the queries regarding our topic today. We thank you for making us understand and realize few important points about the topic. And my heartfelt thanks to our chairperson, Dr. Neeraj Chadav sir, for his amazing encouragement and guidance to make this webinar a success. And a special thanks to my co-moderator Dr. Apurva Kumar Datta sir for making the webinar very interesting. And I thank all the online delegates who have joined us and made this webinar a success. And I thank our technical partner, Zydus, for all their amazing support given to this webinar. And last but not the least, special thanks to our office bearers, Dr. Shantakumari ma'am, President Foxy, Dr. Madhuri Patel ma'am, Secretary General, Dr. Bipin Pandit sir, Vice President Foxy, Dr. Basav Mukherjee sir, Vice President Foxy, Dr. Kalyan Barmade sir, Chairperson PAC. I thank Dr. Neeraj Chadav sir for giving me this opportunity. Thank you. Thank you, everybody.